thank you enough. Rather, thank you so much for joining us. We can't thank you enough for your company right here on K24 This Morning. We sure hope that you are enjoying the show. And if you just tuned in, well, karibu sana. My name is Shiko Kaitani. It is Pinktober. And this month, as we do every October, as a nation and, of course, global citizens, we continue the fight against breast cancer by creating awareness and encouraging early screening. This morning on K24, I actually want to focus on what is hardly talked about, and that is breast cancer in men. Did you even think that men do actually get breast cancer? Well, breastcancer.org even goes on to say that less than 1% of all breast cancer cases occur in men. So let's do this, gentlemen, and leave here knowing that there's actually hope, innovation, and support available. Yes, you are not alone. Let me start off by introducing my very able panel this morning. At the far end, we do have Dr. Dan Butorire, who is from the Texas Cancer Center. Also here from the Texas Cancer Center is oncologist Dr. Catherine Nyongesa. Karibu sana. And of course, last but not least, we've got Boniface Mbuki, who is the director at the Cancer Awareness Center of Kenya. Welcome as well. Okay, so let's start off by actually, beginning with what a lot of gentlemen were actually saying, even in regards to, having this discussion that men actually do get breast cancer. Dan, let me start off with you on this one, Dr.
Yes, it is true that men get breast cancer. And as you have quoted rightly, when we put all people with breast cancer together, you find that men will be accounting between 1 to about 3% of the statistics. So it is true, men are also affected by breast cancer.
Wow. Dr. Catherine, even in terms of our anatomy, I think this is where, it becomes so confusing because men will say, I don't have breasts, so how am I getting breast cancer?
Yeah, actually men have breasts. Just like women, they have 2 breasts.
Yes.
It's just that their breast tissue is smaller compared to the women. And a woman's breast goes through a lot of anatomical changes, like during puberty, pregnancy, breastfeeding, menopause. So it is exposed to a lot of trauma compared to the man. And that's why male breast cancer is quite rare, but it does occur.
It does occur.
Yeah.
Bonnie, from your work on the ground, how do men respond to this?
Sometimes it's a bit difficult for men to go for breast screening. Actually, in the many events you have ever done for breast cancer screening, very few men who go for breast screening, and those who come, in case we get, it's a bit hard to get one. But when you get one, as the doctor says, it's like at least 1% of the people of a very big population. But surely men are not able to go for screening, especially breast screening, because usually men shy away from screening. Even going to hospital sometimes is difficult for them to go. So it's a bit difficult for them to go, but we are really outside there trying to tell men, really go for breast screening, because it's very important.
Okay. So when they have been diagnosed, what have you seen on the ground? Are they able to cope with this kind of information? Have you seen cases where men completely shut down because, first of all, how am I getting a disease that is associated with women?
Actually, men, it's very difficult for a man to come out clearly saying, now I have breast cancer. And especially when they are diagnosed of breast cancer, when they are undergoing treatment, they shy away and they hide from the public. They don't like talking about breast cancer or about their own health, actually. So if their own health, they cannot be able to stay or to say, to pronounce or say out loudly that I have a certain kind of disease. What about breast cancer? Now that currently people think that breast cancer is only for women, men don't like coming out very clearly about breast cancer.
Okay. What would you actually say really characterizes breast cancer in men? Is it the same symptoms that we actually see in women, Dr. Catherine, or how does it present itself in men?
Actually, the presentation is the same. Unfortunately, because men have less breast tissue, so the cancer spreads within that tissue very quickly. In terms of the presentation, one will have a painless lump. Sometimes the nipple will pull back, changes in the skin like an orange, you know, we call it peau d'orange, like a lemon, you know, the skin, how it looks like. So you'll see like pimples or the skin is pulling back.
Yeah.
They may have a nipple discharge or just a discomfort.
Right.
And sometimes you just see one of the breasts is enlarging. It is normal for people to have different sizes of the breast. One is usually smaller, the other one is bigger. But when you see a sudden change in the normal state of your breast, then it needs to raise an alarm.
Right.
Yeah, but the good news is that breast cancer is very rare in men. And actually there is no standard routine screening for breast cancer in men.
Okay.
But what we encourage men is that to be aware of the normal anatomy of their breast.
Right.
Like how does your normal breast feel like, you know, the texture, the size. Yeah. So,
Okay. Okay. Well, we're going to ask you to actually participate by calling in or even sending in some of the questions or comments that you have through our social media platforms at K24 TV on Instagram, Facebook, and Twitter. If you actually prefer to call in, well, the numbers are at the bottom of your screen. Dr. Dan, in regards to who's at risk here, what can you actually say are the contributing factors to a man actually getting breast cancer?
So there are risks for breast cancer.
Yeah.
And the number one important risk for breast cancer, especially in men, is what we call genetic predispositions. There are some genes that you inherit. You can inherit from your lineage.
Yeah.
And these genes, if they mutate, they put you at a very high risk of getting breast cancer.
Right.
And these genes are called BRCA1 and BRCA2 genes. Men also secrete a hormone called estrogen.
Right.
You know, it is known that women are the ones who produce estrogen, but also men produce estrogen, but it's just that the levels are very low.
Exactly.
So estrogen as a hormone can predispose a man from getting breast cancer. And other things that can predispose men from getting breast cancer is the issue of alcoholism.
Right.
Alcoholism causes liver damage.
Yeah.
And as you understand, it is in the liver where the breakdown of cholesterol happens.
Right.
If you have high cholesterol in the body, this cholesterol can be converted into estrogen.
Yeah.
And then it predisposes you from getting breast cancer.
Right.
Even the weight.
Yeah.
We are talking that if you have a high BMI, you are also at risk of getting breast cancer because of lack of physical activity. So these are the major risks, not forgetting even cigarette smoking. Those are the major risks.
I like the fact that the last three that you've mentioned actually have a lot to do with your lifestyle choices. And, you know, it's interesting, Boniface, because this country, sorry to say, has been known for its drinking culture.
True.
That, you know, we are just off the charts when it comes to actually our alcohol intake. And, you know, not to point fingers and say, oh, it's the men, but of course, you know, you're seeing the numbers quite high in regards to how much alcohol men are taking. Listen to this, alcohol intake, he's talked about liver disease and being overweight. Your thoughts on that?
Actually, in terms of alcohol, there's no amount of alcohol that is enough for your body or for you to take. So you, actually what you have been doing is try to make sure that people don't take that beer or that alcohol in excess. People usually say, I mean, alcohol initially, it was not used for just drinking beyond yourself. So people currently, they just indulge in alcohol excessively the whole night, even 2, 3, 4 days.
And I can imagine how difficult your work is, because here you are, you're the director of the Cancer Awareness Center, awareness being the key word. When you go on the ground and you actually tell men, maze punguza mzigo, please, you know, how are they responding to this? That by the way, you know, you need to tone down on that alcohol.
Actually, we have been trying to do that, but unfortunately, when most of our friends are usually in the bars, so when you go to these bars, when you try to talk to them, they say, no, 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 no. Even those people who die not of alcohol, like let's say like accidents, they don't die out of alcohol.
We will die
out
anyway.
Of cancer. They will still have to die.
Really?
Yeah. So it has been a tall order to them, for them, especially men. Now that you know they take a lot of alcohol. Although these days also women have also indulged themselves in a lot of alcohol.
Right. Very true.
There's no alcohol without a woman near you. So most of for you to get to continue taking alcohol to the longest hours, a lady has to be next to you most of the time.
Oh wow! I like that. Very good point, Dr. Catherine. In terms of the diagnosis, how is it done? Explain to us the process in in how you actually arrive at that diagnosis that someone actually is, you know, with this disease?
Okay, maybe just to mention that another risk factor is the increasing age, and just the fact that also men have breast, they may get breast cancer, though it is rare. In terms of diagnosis, one is that most of the cancers are picked by the men themselves or their loved ones. So it is good, as a man, you need to be aware of your normal anatomy of the breast, but let your loved one, if it's your girlfriend, your wife, also be aware. So it is normal, it's good, it is normal to feel your breasts. So don't be ashamed, even your man's breast, feel them so that you know. And then when now there are those changes like lumps, then they need to go to the healthcare provider. And one of the ways the doctor will first take history and examine you in the journey towards making the correct diagnosis. After that, they will take what is called an FNA, or, you know, they take some sample from the breast tissue or from that lump to test in the lab. And that's more of a screening test. Once they confirm that they suspect it's cancerous, then they'll take a tissue called a biopsy. Now the biopsy will be reported by the pathologist, and that's the only way to confirm that you have breast cancer. After that, then the doctor will take you through staging tests, which are just similar to what women go through. They may do a mammogram, a chest x-ray, an abdominal scan. And then once they know the stage, then you'll now be advised on the treatment, which could be surgery, chemotherapy, or radiotherapy.
By the way, you know, I came across an article online that actually talked about how men need to go and have themselves checked, especially if they've had history of breast cancer from women in their family. So could that also be, you know, one of the things that we definitely need to keep in mind, Dr. Kathleen, that if there have been women in your family who have had breast cancer, you could, as a man, also be at risk?
Definitely, because that's what we talked about. It could be genetic. There could be those BRCA gene mutations that are running in the family, and they don't choose you. Men and women can inherit them too, and puts them at a higher risk of breast cancer. Like you remember Angelina Jolie, she knew in her family there's a very high rate of breast cancer, and it's because of those BRCA genes that she inherited and opted to go for prophylactic surgery to remove the breast. So men too can inherit those genes from the family.
I understand we've got Shege on the line. Good morning, Shege. He's always tuned into K24 This Morning. Good morning, Shege.
Yes, good morning, K24.
Yes, karibu sana.
Thank you very much. You're talking to Chege from Muranga or Patson. Yes, and you already have a good topic.
Yes,
and my question is, what are the signs to show that somebody has got breast cancer?
Okay, fine. Thank you so much for that. All right. Asante sana, Shege. I think maybe Dr. Catherine, you could just highlight, I know we talked about it before, but maybe he just tuned in right now. Very quickly, the signs to show that one has breast cancer, or at least you should say the symptoms. Okay,
so one is the asymmetry. A sudden change in the size and shape of your breast. A lump. The lump could be painful or painless. And this lump slowly keeps on growing or enlarging. The skin changes. Dimpling of the skin, sometimes it pulls inside. Nipple retraction. You see the nipple is most of the time pointed outwards, but when you see it retracting, going inside, you may have a nipple discharge. And when the cancer continues spreading, you'll have lymph nodes in the armpit or above the collarbone. And if it gets into the systemic system, then it can spread to the lung, the liver, and the symptoms now will depend on where the cancer has spread. For example, if it's in the lungs, then you'll have cough, chest pain, difficulties in breathing. If it's in the liver, you find the eyes are turning yellow, pain in the abdomen, the liver may enlarge. So when you touch your belly, you feel like there's a swelling.
So because it has spread. And now I can understand the emphasis on early screening, because if it's not caught in good time, the spread. He's just highlighted something, and I want us to actually talk about this because every time probably be talking about something that is related to men, Dr. Dan. What a lot of the physicians on set will say is that men ideally are not exactly proactive in regards to their health. And so my question is, do you see a lot of cases of advanced stages of cancer simply because men will wait until the very end now to come and start seeking help?
Yeah, unfortunately, Shiko, because of that small breast tissue, by the time a man is presenting with a breast lump, most of the time it's already too late. So for men, if we wait for breast lump, then we'll be like getting them in advanced stages. And then you see our society, patriarchal nature of our society, is that men have poor health-seeking behavior. You know, all through in life, you find that women are getting pregnant. When they are pregnant, they go to hospital for checkups. And then they are taking their kids for those immunization and checkup. And then also they are left home to take care of the kids. So when they get a problem, they rush to the hospital.
Okay, hold that thought right there. Don't forget what you were just saying, because Joshua is actually on the line. Let's take that and then get back to you, Dr. Dan. Yes, good morning, Joshua. Do we still have Joshua? Joshua, good morning. Okay, it seems like we have lost Joshua. Yes, so you were talking about health-seeking services. Behavior rather,
Yes, men have poor health-seeking behavior compared to women.
Right.
And then again, they say 80% of the patients who come to the hospital, they are coming because they have a discomfort. Either pain, mostly
that's
actually,
excruciating, literally,
pain. It's what makes people sick, attend medical attention.
Right.
But you see, cancer in its early stages, as Dr. mentioned, it doesn't present with pain. And we see again, even if it's pain, men have been, the society has made men to harden up.
Toughen up.
Yeah, that when you have pain as a man, don't show everyone. Don't start crying, you know. Don't start running here and there just because of pain on your chest, anterior chest wall. So this has really reduced the number of men that we see in the hospital.
Right, right. I think that is so unfortunate, though, Boniface, that, you know, how we have conditioned men, you know, to be is what is actually a contributing factor to them not seeking these health services. Why, in your opinion, are men just not going to actually, you know, put their hands up and say, okay, you know what, me too, me too. Do you think the ego factor is what Dr. Dan is actually talking about? Plays a huge role.
True. Actually, men have what we call inferiority complex of a kind. Not like women who are like very much social. They are like, actually, it is said that human beings are social animals. But I think that women are more social than men. Men doesn't talk about their health, even in public, even to themselves, even on one-on-one. It's a bit difficult. I don't know what happens in the men, especially me as a man. When I go to a hospital and I get a doctor there, maybe I have 2 or 3 ailments I need to speak to a doctor. I only speak of one that is visible. But the one that is more inside me, utanyamazia too, until that day, maybe I'm admitted in the hospital. Then I will tell the doctor, no, I was feeling a pain somewhere, I was have another issue somewhere. So I think men has a big problem.
And you know, it's funny because whether you're going to talk about male sexual dysfunction, whether you talk about HIV, whether you talk about cancer, all the doctors will say the same thing, that men will show up at the tail end of it. So we are going to talk a little bit about the support system and how to encourage men to actually, you know, talk and speak openly about it. But Joshua is on the line, and then after that, we'll probably be going to a commercial break. But yes, good morning, Joshua.
Morning, Shiko.
Yes, we lost you. How are you?
Yes, I'm good, and morning to the panelists. A very good discussion this morning. But I have I have an appeal, Shiko, if you allow me, to our panelists.
Yes, very quickly though.
Because I believe most of them are medics, and I think if you listen to the conversation in the country, people have gotten really fatigued by the talk on cancer this, cancer that, all forms of cancer. And I'm speaking as a person who has his friend actually who is undergoing treatment for cancer in India. I think I want to appeal to our government and to the practitioners let us move away from the conversation on cancer and go to action so that we can give hope to people, because we all know how cancer today is. We may not really know the causative agents per se, but people know about the symptoms. People have been sensitized on going for checkups and all this. But the biggest problem that is ravaging families and people is the treatment. Can we push the government and put pressure on them so that we can bring care for these cancers closer to the people and make it affordable? Thank you very much.
Absolutely. Thank you. I absolutely love what Joshua has actually brought up this moment. It's what's next, even in terms of the treatment and available services for those who are fighting cancer. Of course, I'm going to task the two of you on this one, Dr. Dan and Dr. Catherine, in terms of what are we seeing on the ground. Yes, you've got your private institution, Texas Cancer Center, but of course you also know what MOH, which is the Ministry of Health, is actually doing on the ground for cancer. What are we seeing in terms of the advancements so far, in your opinion, Dr. Catherine?
Okay, one, you know, cancer spans from awareness, early diagnosis, and timely treatment, and even research and mobilization of funds. So we do have what is called the National Cancer Control Policy, which is in place. And out of this, the government rolled out the cancer screening guidelines that can be adopted even at the primary health care level. What should people be doing about it? We don't want to wait. You know, when it comes to treatment, it's at the tail end, and that's where people are getting frustrated. But now we want to move back to the grassroots. What is wrong? What is causing this cancer? How can we detect it early to reduce the financial burden on the families? In terms of training, in history, you know, before we had like maybe 10 oncologists, but now at the end of this year, you'll be surprised that Kenya may be having at least 100 oncologists, which is a very big improvement in terms of that. And then we look at infrastructure. The government has tried. There are
the machines coming
centers that were set up in Longisa, in Bomet County, in Machakos. We have in Mombasa, Garissa. So there's a lot of effort and talk going on. There's universal health care, where people don't have to travel all the way to Nairobi to seek screening for cancer. And that will be done in Mashinani. In terms of infrastructure, we have the city or cancer screening equipments which were rolled out, mammograms. You don't have to come to Kenyatta to line up for a mammogram. It can be done in the counties.
So what do you think is the biggest stress on the patient? Is it the chemotherapy that is actually costing the highest, you know, in terms of a financial burden? What's your take on that, Dr. Dan?
Actually, there is a national insurance, health insurance scheme.
NHIS,
This national health insurance scheme can actually cater for your treatment. The only thing is that very few Kenyans want to spend money on NHIF because they think they are not going to fall sick anytime. But now, what also we emphasize that there are two major categories of cancer. You have what we call the solid tumors, and then the hematological malignancies that affect the blood system. Most of them are the solid tumors. And treatment is not just the chemotherapy and radiotherapy. Actually, the same mainstay of treatment is surgery. And surgeries can be done even in a very lower facility in the county hospitals, in the sub-county hospitals. Actually, that is where we need to put more emphasis, because if cancer is gotten early, in its early stages, and surgery is done, that is the best treatment for cancer.
All right. I hope that actually does answer, you know, some of the questions that are already coming through in terms of what next and what about the available options that are out there for those who are battling cancer. I love what our team from Texas Cancer Center have actually stressed on, but of course, we will talk a little bit more about that, and even in regards to the psychotherapy, social support as well, for, of course, those who are battling with cancer. and even how, by the way, to perform a self-examination test will be coming up right here on the show. So please don't go away, and of course keep talking to us through those social media platforms at K24 TV on Instagram, Facebook, Twitter. If you want to call, the numbers at the bottom of your screen. Keep it K24.